Hi, this is Rachel Zelon, President of HRI. I'm pleased to take just a few minutes to update you on our efforts during this incredibly difficult time facing the world because of coronavirus. HRI has been leading education, prevention, and relief efforts in Haiti and Guatemala since early this year. Let me reassure you that this work is in addition to and not in lieu of our ongoing programs addressing child nutrition and improving child outcomes. Thanks to amazing donors and partners, HRI has successfully reached tens of thousands of people during this period, many of them new to HRI programming. In Haiti alone, we have 100 good health ambassadors working in their communities and continuing to share critical and life-saving information with neighbors, friends, and family about the coronavirus, its symptoms, how it is spread, and how to prevent infection within the home. We have put out 125 hand washing stations. They have been positioned or are ready to be strategically positioned in the very large slum community of Delmas 32, where we've been working for several years now. Each station provides up to 50 hand washings per day. That's over 6,000 a day, or close to 190,000 hand washings per month. We know that good hygiene, particularly regular hand washing, prevents the spread of the coronavirus. A group of women come to our office daily to work on the production of masks that will protect them and their families and the children and staff in 18 HRI-supported orphanages. They will then sell most of the masks to the public to ensure that they have regular income for their households. Our goal is a total of 2,000 masks to be completed by mid-August. We train 35 women to make detergent and disinfectant for their personal use and to sell for income generation. There is a huge demand for these products in general, and particularly now during the pandemic. HRI is calling hundreds of people each week to check on their health status, refer those in need of medical attention to the proper locations, and to offer any emotional or psychosocial support needed to get through this very scary and difficult time. Our Haitian nurse and social worker continue to go out several times a week to orphanages to check on children's health, to do hand-washing trainings, and to teach them about the virus and how to avoid infection. Luckily, we have seen no infections within the orphanages we work with and support. As I mentioned earlier, this is all in addition to our ongoing work with orphanages and at-risk children in Haiti. In Guatemala, HRI has successfully provided seeds, fertilizer, and pesticide to 86 farming families in rural villages. This ensures that even with the closures and quarantines, these families will have their crops and food for their families well into 2021. We continue to provide emergency food relief in rural villages as well as in Guatemala City. In the villages, we are providing food to those families in distress, and in the city, we are targeting elderly individuals, persons with disabilities, and women-headed households in which the children are too young to be left alone. Thousands of meals are provided weekly. HRI is calling hundreds of people each week in Guatemala to check on their health and well-being. Our social worker and psychologists provide emotional support as many people are suffering high levels of stress, depression, distress, anxiety, fear. Most are frightened of not having food to feed their children. HRI is working with 4 volunteer psychologists who are offering free clinical services via telephone and texting to assist people suffering from the emotional effects of isolation, fear, depression, and the inability to work. We continue to send thousands of messages daily via WhatsApp and other social media platforms to ensure that people understand the virus, how to protect themselves, how to care for themselves if they become ill, and where to go should they fall ill enough to need hospitalization. Again, this is just the tip of HRI's iceberg. There is so much work being done for so many people facing uncertain futures. People frightened for their health, for their children, and for their ability to feed and care for their loved ones. We are there for those who need us, and we will continue our work tirelessly. I thank all of our donors, our partners, and our friends. We could not do any of this without you, and there is so much more work to be done. So thank you for your continued support.